Valerian is one of the oldest and most widely used herbal supplements for sleep, anxiety, and for calming nervous system. It has been used for more than 2000 years. Even Hippocrates mentioned valerian for its calming effects. Today, we will discuss when valerian is actually effective, how effective it is, how to use it correctly, how long it should be taken, and the main limitations and side effects of it. Valerian is plant with flower. Part we use is the root. It's underground part. Now let's clarify in which cases valerian is most effective. Valerian works best when a person has stress and stress-related sleep problems. Its main mechanism is that it enhances gamma-aminobutyric acid signaling, which is the main calming neurotransmitter in the brain. As a result, it reduces hyperarousal, meaning less overfiring of neurons, brain cells. Because of this, sleep comes earlier and person falls asleep faster. The major advantage of valerian is that it does not suppress rapid eye movement sleep, which is called REM sleep. This means that sleep architecture remains intact. The standard dosage of valerian is 400 to 600 milligrams of a standardized extract taken 1 hour before bedtime. However, the point is that you need 2 to 4 weeks for meaningful effect. That's why its continuous intake is important to see its result. The second important indication of valerian is anxiety. Anxiety, which is related with physical tension and physical stress. When a person feels inner tension, stress-related palpitations or muscle tightness, dosage here is also around 300 to 600 milligrams per day, once or twice a day in the morning, if there is anxiety mainly during the daytime, and evening dose and minimal duration should be around 3 weeks. And third, valerian can be somewhat effective for irritable bowel syndrome like symptoms like bloating, cramping, stress-related gastrointestinal discomfort. But its effect is indirect. It reduces neuronal excitability. Valerian calms enteric nervous system. It leads less spasms, reduced cramping, and better regulation of gut motility. In this context, valerian is effective about 40% of patients. It is less effective when there is clear organic damage or structural bowel pathology. Typical dosage is 300 to 400 milligrams per day, once a day or twice daily. The main mechanism of valerian is that it inhibits breakdown of GABA. GABA is inhibitory neurotransmitter, and it reduces neuronal firing and produces calming effect on the brain. Valerian acts for about 4 to 6 hours, and its peak occurs within 2 hours. However, for full stable benefits, regular intake is needed about 4 weeks. The most common form of valerian is capsules and tablets, and they are preferred because of standardized dose. They have no strong taste or smell, and they are most studied forms. There's liquid forms also, but they have faster absorption and it allows of flexible dosing, but they have strong taste because usually they are alcohol based. Mainly they are used in anxiety when there's acute anxiety with sensitive digestion. Tea forms also exist, but they are rarely used because they are weak. Best intake regimen is that valerian should be intaken with a light meal, which improves absorption and reduce stomach irritation. When taken on empty stomach, it can cause some mild digestive symptoms. You should never intake valerian with combination with alcohol or benzodiazepines because all of them have calming effect, and benzodiazepines and alcohol have depressing effect on central nervous system activity, and this effect is added or multiplied, and it is risk of excessive sedation. Valerian does not cause dependence or addiction because it does not stimulate dopamine. It also almost have no tolerance effect, so higher doses are not needed usually. And Valerian is considered safe for long-term use, but usually they are used for 3 months or 4 months, sometimes up to 1 year. Valerian may have some mild side effects like lightheadedness or dizziness or gastrointestinal discomfort, but nothing special. And sometimes daytime sleepiness or vivid dreams or mild agitation for some people. It's counterintuitive but and paradoxical reaction, but in some people it causes agitation and opposite. Instead of feeling calmer, some people feel more restless because of individual difference of gamma aminobutyric acid receptor sensitivity. In this case, Valerian should be stopped and symptoms resolve on their own. Valerian is not recommended in pregnancy, breastfeeding, and children under 12 years old.